what role do parent carers, who are members of a parent carer forum, have in monitoring healthcare services provided for their disabled children? With Sheila Davies, Parent Carer Participation Manager for Health.
Well, another example I can think of took place last year in Southend, and the parents were coming to the forum and saying they were really unhappy with the wheelchair service there. One of the problems was there's very, very lengthy waiting times, so children, by the time they got their wheelchair, had already grown out of it. The parent forum contacted the Primary Care Trust and explained what the problems were, and they worked with the Primary Care Trust to draw up a new service specification to describe what the service should look like if it was going to meet the needs of disabled children. This was then rolled out and is being provided by an external organisation. But one of the things the commissioners did was they also asked the forum if they would actually help monitor the service so they could make sure that it was actually working well. The way they do that is parents who are experiencing problems with the wheelchair service contact the parent forum and tell them about it. Many parents don't want to make complaints about the service their children receive, and that is because they're worried. They're worried if I make a complaint, it actually might affect the service my child gets in the future. But being able to go and talk to somebody who's a third party, like a parent forum, is much easier for them. And the parent forum can report the problems back in an anonymous way. This way, very often when problems have taken place, the parent forum has suddenly rung the commissioner and explained the problem, and it's been resolved very quickly and easily. And of course this is a huge advantage to a commissioner who's actually outsourcing services. He's got a third party there who's just feeding back if it's working well, but also if something goes wrong, they're picking it up quickly. And this means that fewer patients are actually going through the lengthy complaints process, which is expensive and not fun for anyone. Well, that's one of my roles, is to actually share this. I've spent a lot of time finding out where there is good examples and then trying to make sure all the other forums hear about it in the hopes that they can replicate it. There is good practice, and I do find, I think, what's quite exciting, as I said, is that once the professionals understand what participation is and they see an improvement in the service, they want to continue working with parents that way. So I really think over the next few years is a really exciting time. There's a real big opportunity now to sort of start and improve services. But I will say it's a slow process. It is a drip, and some of the forums would like to change everything tomorrow, but obviously they haven't got the resource to do that, and it's a case of just taking it a few steps at a time.
For further help and information, you can call our free phone helpline on 0808 808 3555, and you can also visit our website at www.cafamily.org.uk.